Welcome to Health Attentic, Dr. Krishna. So, first question. Normally, we see all the ads about toothpaste. We have neem, we have salt, we have Ayurvedic formulation, we have charcoal. So, are they really worth taking those toothpaste, or does it have any scientific meaning or reason to go with such toothpaste, or which toothpaste among this is best? Ayurvedic, charcoal, neem, salt, which one is best?
Nowadays, so many ads coming out regarding different sorts of toothpaste. As you have specifically mentioned, in the ancient times, there were different sorts of materials which were used. For example, as you told, charcoal. Charcoal is assumed to be a toxic intake substance, like it absorbs the toxins and it absorbs heavy metals in the product or in the oral cavity. So in that aspect they were using it before. Coming on to neem. Neem is such a product, everybody knows it's an antibacterial. So it acts as an antibacterial agent and helps in improvising the gum health also. And always there is a continuous bacterial load in the human body system. Not only human body, you take any of the organism, there's continuous bacterial connection with the body. So there are commensal bacteria, there are facultative bacteria, there are other sorts of bacteria which depend upon the human body, and human body depends upon the organism. So because of that, to control the bacteria which cause toxicity or some sort of adverse effects onto the body, such kind of products as neem will help us in giving a better result in decreasing the bacterial load, that is the aggressive bacteria, and improving the oral health. So this is about the neem product which you're talking about. But as you see, as a generalized thing, there are many products which show out many things, but it depends upon what is our requirement to take upon and decide which toothpaste to go along. But as a general composition in toothpaste, fluoride uptake for the tooth is very important. Along with that, because of the additives whichever, so depending upon the patient's health condition or the other tooth related condition, you can select whichever ingredient you want more in it.
What you mean to say is there is no one single toothpaste fit for everyone. So depending on the need, each one has to select a different toothpaste, right?
So to be more elaborate, if I want to tell you, a patient comes to me that he wants a bit of more amount of strength in his tooth. So my recommendation would be something like excess amount of fluoride.
Okay.
That is because excess amount of fluoride will change the, see, in tooth there are three different layers. One is enamel, the other one is dentine, and the other one is pulp. I think this everybody knows because of the Google knowledge and
right, right, yeah.
So the topmost layer, which is enamel, is the hardest layer. It is such a layer which is like a diamond with less amount of organic particles and more amount of inorganic. To be more simplified, inorganic is something like more amount of mineral content.
Right.
So it contains something called as hydroxyapatite crystal. So to strengthen that, you will have to change the formulation to fluorapatite crystal. So because of that increased fluoride uptake by your tooth, there is increased amount of strength which is increased in the enamel and dentine structures because of the uptake. So and we cannot tell that you will have to use that toothpaste into your entire lifetime. So heavy amount of fluoride toothpaste are meant for a specific period of time, and then you will have to taper it off. So in the same way, other ingredients whichever are specifically added, depending upon the gum condition or tooth condition, we can use it for some time and then keep changing it. But in the regular basic toothpaste, which contains of some amount of abrasive, some amount of fluoride, some amount of other agents which help in increasing the gum health and the tooth health and decreasing the bacterial load, is okay to use in a day-to-day practice.
Yeah. So what you mean to say is, when you want to strengthen your teeth, you have to go with the fluoride treatment,
yes,
fluoride toothpaste for a certain amount of time.
Yes.
And when to go with the charcoal?
See, charcoal is again, that's what I just mentioned to you. So it is a product which is assumed to take up the toxicity substances which are present in the oral cavity, bad odor and all. but scientifically proven, it's again a question mark thing, because there are much amount of controversies regarding that, because minimal amount of product in a small pinch of toothpaste, which doesn't matter much, it's like a drop in an ocean. So yes, but again, if you ask me specifically regarding the scientific proofs, any toothpaste which is approved by the American Dental Association or regarding the FDI, World Dental Association, can be used on a day-to-day basis.
Right. So, do you mean to say there is no specific proof that charcoal added in the current form of toothpaste has any use?
You take a water filter. They tell that they have added charcoal filament in it, but you exactly cannot show the proof that how much toxicity it's absorbing. It is the
Right.
same way in the oral cavity also. So research based evidence is not to that extent regarding these minute products. Neem, yes, there are so many research has been done, and there is more amount of inclination towards the organic and natural products nowadays. So depending upon that, there are many scientific articles which are showing good results. So neem or babool. Now you can even see the herbal products used like Triphala churnam and all. So these products are giving a better result, which are added into the toothpaste in the recent era.
Right. So, when to take neem toothpaste?
Yeah. So when a patient comes to you with more amount of gum issues,
Okay.
for example, you say that a patient comes to you with bleeding gums, you might definitely recommend something which is more antibiotic, more antibacterial, and you can go for chlorhexidine for that case, which is non-natural form. If a patient is not comfortable with a non-natural form, go with a neem extract toothpaste. You can specifically give a neem extract mouthwash. Because olden days it was like chewing neem stick,
Right. Yeah.
which gives lot of betterment in the gum health,
Okay.
and that is true. But that time the body type was different. It was more robust and more aggressive, and the body build was different, and the food intake and consumption was different. But nowadays everything has become refined and processed from the food you take or from the day-to-day product which you use. So in such a condition, other than just adding something in the toothpaste, if you want more better effects onto your gum health or decreasing the oral bacterial load, my suggestion would be something like use extracts, which can be used as a mouthwash or which can be used as rinses, which can be used as other oral medications, can help the oral cavity in a better way.
What about our toothpaste has salt? So, famous slogan. When do you
See,
take the
that is because
toothpaste with salt?
again ads are nowadays to promote a product. So similarly, in the same way, salt is nothing but sodium chloride. Everybody knows. Now there are again different sorts of salts which are there in the market. So we'll just talk about a basic salt, table salt, which is sodium chloride. So sodium chloride helps in reducing inflammation. Everybody knows that. So it helps in decreasing the bacterial load again because of the salinity which is present. Normally, if you see our body type, it is basic or neutral pH, which is approximately 6.9 to 7, whatever our body type is there. So if you are increasing the pH or decreasing the pH or playing with the salinity aspect, definitely there is a change which goes on into your body. In the same way, when we are using salt, when there is increase in salinity, simple, when we go into a beach, when you try to expose us to the salt water for more amount of time, there is some sort of irritation onto the skin. In the same way, when there is more amount of heavy salt in the water which we rinse every day, if you are using it morning and evening, the bacterial cell wall which is there will rupture, or there is something called as exosmosis, or moving of water from higher concentration to lower concentration or lower concentration to higher concentration, vice versa. So in this, exosmosis is something where the cell concentration is low and the outside water concentration which has salt is high. So water is drained out from the bacterial cell to the oral cavity. So there is a chance of cell collapse.
Okay.
So that helps in betterment of bacterial reduction and increase in oral health. In the same way, that even causes shrinkage of the gums, which helps in holding the gums a bit more better tight to the tooth or the bone concept.
So this is again when there are bleeding gums or issues with the gums. It is better to go with the toothpaste
Yeah,
with
if
the
not,
salt.
if you again want to go with a day-to-day usage, once or twice a week is recommended because it definitely maintains the good oral health and it's like a home remedy which is there in your kitchen all the time. You can definitely go along with it.
Okay. Thanks, Krishna.